Welcome back to Ladies of Another View. I'm Beck, and we are once again joined with Dr. Maria Dwyer, who is a biological dentist. And we were talking about those amalgam fillings. And I want to make clear, because we were talking about during the commercial, she said, don't go and have your fillings removed. You need to be SMART certified. You need to be, right, you have to have an expert who knows what they're doing if you're going to have them removed.
Yes, I would recommend, it's very, very important that if you decide that maybe mercury is not the best fit in your mouth, in your body for various health reasons, I would suggest that when you do decide to have them removed, that you have it done by a SMART certified dentist. SMART is an acronym. It stands for Safe Mercury Amalgam Removal Technique. Okay, and it's really important that you have them done by a SMART certified dentist, of which there's only just me and Bismarck Mandan. But the reason that's so important is because when the dentist goes to remove your amalgam filling, that mercury and that vapor is just, I mean, you should, if we had a certain type of light as the background in an operatory, when a dentist is removing that silver filling, you'd be able to see just that room, it's like a smoke of mercury vapor that fills up that room.
Well, and if you're not photo up, if you're not, you're talking.
Sure, if you're not protected,
because
you will breathe that in.
Being protected when you remove fillings, because you have to take precautions, right?
Right. So I do this all day long, every day. I got sick from doing this because I wasn't taking appropriate measures, and my health deteriorated. And so, unfortunately, I learned the hard way. And if I can help avoid, anybody else go through what I went through, I'm happy to do that. But I am protecting myself with a mask specific to mercury that helps kind of block out some of that mercury vapor. But more importantly, if you look at the patient, she has, she's breathing 100% oxygen, which, any dentist will have that. But we have a special mercury vapor vacuum that we put right up below the mouth to suck the vapor up so that we're not breathing it in. It's not going straight to our lungs. There are more things we do. That picture was taken in the middle of getting myself and the patient ready. So she's not, I wasn't fully set up in that picture. There are other more protective measures that we do, because if mercury lands, like on your skin or your body, it will continue to off-gas that vapor for several hours, studies have showed. So we do a little bit more than that, but the two main elements are the vacuum and the nose. And so please, if you're going to have them removed, have it done in a way that protects yourself.